My name is James McEntire. I am a physician, I am a board-certified pediatrician, and I am also a certifying specialist in the Missouri Medical Marijuana Program. I have been a physician for 30 years, and I have been a local physician in Missouri my entire career. I am a board-certified pediatrician, which is considered a primary care field, but it is certainly a more specialized field than general practice. Yes, I have experienced relationships with patients in single and multiple limb amputation, as well as other body parts, including earlobes and scalp and burn skin victim injuries. One of the hardest things for a patient to deal with, in my opinion, when they experience nerve damage, which is a congruent part of an amputee, the central nervous system of the human body is extremely complex, but it is also plastic and adaptive. But the human body, during the acute and sometimes chronic phases of healing, gets false signal input to the central nervous system from the absent limb region. The peripheral nervous system feeds those signals from the terminal end of the nerve groups, and the brain processes those input in a fashion that it tries to adapt, but oftentimes misinterprets. These nerve signals can be anything from what we consider paresthesias, which can be tingling sensations or annoying numbness sensations, all the way through the spectrum of extreme pain. How does the neurological system respond to an amputation? An amputation occurs as an acute trauma. The blood vessels, the nerves, the tissues involved in that injury have suddenly had an alteration in their physical and functional status. Therefore, the nervous system has to make rapid adjustments to these changes, oftentimes getting confused and trying to adapt and adjust that signal to a interpretable input. Therefore, the patient experiences a spectrum of symptoms from numbness to pain to burning to proprioceptive changes that are very confusing to the central nervous system. And eventually, over time, these symptoms may adapt and modulate down, but often never disappear. Other systems are involved in an amputation. These are quite complex injuries. Therefore, the largest system of organs in the body is your skin. So therefore, your skin is affected. You've got loss of body surface area, which affects thermoregulation in the body. You have loss of circulatory function. You have loss of sensory function. So there are the 5 senses of the human body where you experience a unilateral or sometimes bilateral alteration in processing, causing confusion within the central nervous system and processing adaptations that take many, many months, sometimes years, to fully recover from. Okay. Is there a baseline in time for healing from amputation? There is theories that describe nerve injury recovery if it is going to happen. Nerve injury and neuronal regeneration can occur and has been noted to occur in patients, and we often are very patient and open-minded for this process, and it is estimated to be somewhere between 6 weeks and 6 months before that process has been felt to be given an adequate time to show the healing or changes that will become stable over time. What are the things that an amputee can do to allow them to be prepared for physical and ambulatory and extreme physical activity? That's a good question. The cardiovascular system has been affected because the circulation that went to that extremity obviously doesn't exist anymore. So the nervous system that controls peripheral vascular function, skeletal muscle perfusion, all has to change over time. So the patient needs to maintain cardiovascular health, aerobic activity, and in certain circumstances where they're unable to be able to bear weight, they should utilize water-based therapies and other partial gravity-reducing therapies through physical therapists and specialists who allow them to train to get their cardiovascular and their skeletal muscle responses to be able to handle these new balance, coordination, and adaptations for prosthesis use. What a patient must do to properly prepare for the use of an artificial limb in sports activities is, first and foremost, they must make sure that their distal appendage is healed and can accept the prosthesis without damaging the tissue. So using different therapeutic modalities to get 100% healing of the skin flap is important. Using properly fit prosthesis so that abrasions, chafing, and skin damage does not occur is important. And then prepare themselves for the mental challenges that they will almost for certain experience, not only from internal sources, but from external sources. They may be having experiences of prejudice where other athletes feel that they are a nuisance or in their way. So you have to be prepared to realize that an athlete is as much internal as they are external in their mindset to be successful at a high level of function. A piece of advice that I think would be important to give an amputee that is wanting to begin a running sport or any type of vigorous, high activity, high cardiovascular function event would be to set yourself simple goals and complex goals. Getting yourself to accept simple successes en route to a major success will cause less mental stress where you can't quite grasp that major goal, but you can celebrate minor stepwise systematic goals to reach the ultimate goal. So you will be able to then get satisfaction that you've made these stepwise. And yes, there's going to be small obstacles that you're going to have to overcome, but trying to make small graspable, I don't know what the term I should be using, in order to make small goals and accept satisfaction in those small successes, and then eventually reaching your major goal and the euphoria that you have been a champion, you have overcome your impairment, and that is the ultimate goal of most amputees that I've had relationships with.